And what he clearly said was that the male had a very little role. And I would go ahead to say that our biases towards the female is so strong that societal perception still remains that it's more of a female problem. So we go to couples go to a gynecologist before even going to an infertility specialist. When it comes to diagnosis, the number of tests that are done on the female and the number of tests done on the male, and that too, even today, when the semen analysis is done, we are never happy with the report coming from different cases because we can never be sure. And even if we look in the field of IVF, the progresses that have been made are, in terms of ART per se on the female side, the diagnosis, even there's so much of improvement, right from the stimulation protocols to the work that is being done. But in the male, if we see, today, even if you look at the semen processing techniques, there's not been much change over the decades. And if you have, Edwards published his first paper in Nature with Swim Up, yes, there have been some modifications, but the modifications are barely anything. And what we have is density gradient, which is still the time-tested method. Over the last few years, there have been new methods that have come in, but none of them have stayed as far as coming to sperm preparation per se is concerned. We have MAX again used in specific cases, but somehow we are not really having a good method, or we have not really progressed, I would say, in really identifying a method. We are happy when we have a good number of motile sperms. And if we go ahead, is there really a need for newer methods? And I would say yes, because we try to select the sperm. And with ICSI, I would strongly say that even the best embryologist in the world would not be able to play the role of the zona, because we don't even know how the zona selects the sperms. So when we don't know that, how are we really selecting sperms? And that's the reason now we are really trying to explain to people that please, conventional IVF has its role. Let there be some level of natural selection that is possible. And therefore, there has always been the search for newer methodologies, and many techniques have come and gone. And if you look at even microfluidics per se, it's nothing very new, because basically they're trying to look at movement of cells in a fluid. And this could be even the non-motile cell. So people should not think that it is the sperm moving, but any cell, even particles, will move and in these microchannels, and it has been used in other systems way back in the 90s. So the principle of sorting is simple. It's not just based on the motility of the sperms, but it is the movement of the cell in a fluidic channel, and the movement is not essentially linear. It can be upward, it can be in any direction. So the principle is that is there used is, yes, the sperms move, and actually one doesn't really know what really gets them to sort these samples. It is not dependent on the dimensions alone. There are many factors that are coming in. And if you look more specifically, when we are looking for microfluidics for sperm preparation, it had been long ago. And one of the first uses was way back in 1993. However, it's all about the movement of the sperm in those microchannels. And the whole thing is how to get these slides which make the microchannel. So although on the research arena, it came many decades ago, it's not possible for anybody to actually get into this in a clinical perspective. It's like the days when we started, there were no ready-made needles available for ICSI. And you can imagine the plight of actually making injection and holding. And if they were not really available, I don't think we would have many ART clinics doing ICSI today if one had to prepare. For me personally, it was as if I'm a glassmaker to sit and, have all those 3 units to prepare needles. So something like this, yes, the technology was there, but it was not possible to utilize it. And then I would say it was only in 2013 that the Harvard MIT Demicri et al. Actually prepared a thing which could be implemented and produced on a larger scale, which could be utilized for ICSI. So the current devices that are available, and I'm not going to go more into the methodology, as Ekta is going to give the demonstration of how it is used, but it's very simple. You load the device and then you have the sperms moving with the microfluidics as well as their own motility and their selection. So I'm primarily going to talk about the reports that are there, not on the methodology, because that's going to be shown. About the experience, we have Pranay and Vijay Mangoli who will be speaking. But what were the reports on microfluidics using this technology for selection of or separation of sperms from the raw semen sample? So the earliest reports actually came from China more than a decade ago. And they thought that, basically they were trying to see whether the separation of sperms would be on the same basis that happens with the cervical mucus. The thing that came out prominently was that the motility, the normal morphology, and well as the HOS rates were significantly better when they used sperm separated by microfluidics. And the sperms had a significantly lower rate of sperm DNA damage as compared to swim up. And I don't need to talk about sperm DNA damage. I think Dr. Sarpreet has really gone into the significance of that. But these were early studies that came from Guangzhou. And then when they looked at sorted sperms versus swim up versus non-sorted, the percentage motility was better. When they look at specifically CASA motility, straight line velocity was better, curvilinear velocity was better. However, with CASA, as we do know, we do get a lot of data, but we're still not able to give it significance in terms of functionality. When they looked at ROS generation, yes, ROS generation in raw semen we know is much lower because of the natural antioxidants present in semen. But the moment we remove the seminal plasma, they are extremely subjected to oxidative stress. And that is the reason whether the ROS generation, whether it's just simple swim up sperms or wash sperms, it's much more. And this device, which was then sold as Fertile Plus, showed much lower ROS generation when the separation was done. And naturally, if ROS levels are higher, one would anticipate greater DNA fragmentation. So when they had the unprocessed sample, yes, higher DNA fragmentation, and then you process it using either density gradient or using this chip, and there was much lower DNA fragmentation. So the test showed that yes, using these devices had improved motility or improved recovery of motile sperms. So it's not that it's improving motility, but they're helping recover sperms with better motility, higher percentage, and as well as lower DNA fragmentation. And after these preliminary, as finally see whatever it is, yes, it has low sperms with lower DNA fragmentation, higher motility. What we're really interested in the long term is the outcomes and the safety of it. So I think one of the first papers that was presented at ASRM, it actually went beyond looking at motility and beyond looking at DNA fragmentation, was actually looking at the fertilization rates. And the numbers were very small. It was an abstract. It was a presentation poster at the ASRM, where they showed that the sperm chromatin fragmentation reduced to just about 1.8%, which was nearly 23%. Fertilization did not show a greatly significant improvement, but the number of euploid blastocysts was higher. Although one looks at, I would look with a little concern looking at percentages because the numbers were low, but it was showing and it was giving an indication that yes, using this sorting system did have a better outcome, and one would anticipate if the DNA fragmentation was lower in the recovered samples. So yes, we do know that DNA fragmentation plays a very important role right through and it also plays a big role, especially when now we have older women, so the repair is not so much. And more so, if we are having fragmented DNA, it depends on the level of fragmentation. So if it's highly fragmented, even the youngest oocyte from a young donor will not be able to repair it. So yes, lower pregnancy rate, higher miscarriage rates, abnormalities, etc. And the point is that how do we select sperms with low DNA fragmentation? Because there is enough literature which shows that there is not essentially a match between morphological normality or morphologically normal sperms and DNA integrity. And for that matter, morphology itself can be a big debate on its own, especially when we look at the WHO criteria of very stringent morphology, which makes it very difficult to really assess and then come to conclusions. So for that matter, I was just mentioning that I was at a PCOS conference last weekend, and Dr. Rupin Shah, one of the very celebrated, and the people were asking, like, with 4% morphology, how do you assess and evaluate the patient? He said, I ignore it. So it comes to, because it's so stringent that we really don't know what to do with that. So when you become so very strict, how do you treat? Of course, it's not to say that morphology is not important. The type of abnormalities would make it very important. So you can't say if it's globozoospermia, I'm going to ignore it. But in general, the strict criteria make it very difficult, especially when we see that morphology doesn't match with DNA integrity. So the studies that have been done, so if you're using a sperm sorting system, they did a couple of studies, so primarily male factor patients. And yes, in male factor patients, when you have a high number of abnormal sperms, to get the right sperm becomes more important. And they specifically looked in patients where there was a failed ICSI. So in this case, how did it help? Because I always feel it's ICSI is meant for male factor, but if it's male factor, again, you have, and especially if it is, you're having sperms, so it's a whole lot of abnormal sperms. quote unquote, you're trying to find the best one. Then they looked at specifically cases of implantation failure. Then they looked at conventional IVF. I think Dr. Vijay may speak more about it because he was part of the study. And then they did a sibling oocyte using split semen study. So using density gradient, and then in patients with high DFI. Of course, the last one, there is enough literature now that if you're using microfluidics in patients with high DFI, you do get a better, larger number of sperms with lower DFI, and therefore outcomes are better. So in this particular study, what they did is that they had male factor patients in which ICSI had failed. And in this specific group of patients, they were trying to see sperm chromatin fragmentation or double-stranded breaks. So what they found was that, yes, in the raw semen sample, if there was DNA fragmentation was about 24 plus minus 8, density gradient reduced it to about 19, which is we do know, and it came down drastically to 1.7 after using these devices. On the other hand, even in terms of double-stranded breaks, which are not so high as compared to single-stranded breaks that we see, it came down to 0.3%. So naturally, if the sperms that are recovered had left fragmentation, one would anticipate better outcomes. And even in ICSI, where they did a density gradient separation first, followed by microfluidics or using these devices, again, there they found that there was a reduction. But as you can see, that possibly there was no need of doing a density gradient because there's not much change. But when they put in this, one could possibly skip a step of density gradient. This was interesting, where they looked at recurrent ART failure accompanied by high DFI. And you can see that the recovery in terms of concentration is very low. So if you had a raw semen sample with 40 million, density gradient with good motility came down to 32. But in this, it comes down to 9.1. Now, this really goes on to show, so my initial reaction was when I saw this paper, that it is much lower. But on the other hand, we know that there are large number of abnormalities in a semen sample. Possibly this is some kind of a selective mechanism by which you are actually having a lower concentration, but possibly there's some selection mechanism by which you are selecting maybe better sperms. As far as motility goes, yes, 97%. This particular study talked about 60% motility with density gradient. However, I'm sure we do get much better motility recovery with density gradient, and morphology also slightly better. But what they found was, again, like the previous study, the DNA fragmentation was much lower. From 29%, it comes down to 1.2. So all in all the studies show a lower DNA fragmentation. And this was especially in cases of recurrent ART failure. So one shows that you're possibly selecting sperms with less fragmentation. And in this one, they specifically took at cases where there was an implantation failure. So a failed ART cycle, the failed ICSI cycle, and you can see the fertilization rate was slightly better. The pregnancy rate was 5%, and then there was a pregnancy loss. So basically, it was a failed cycle. And in this failed cycle, these same patients underwent, the only difference was that the selection of sperms was done differently, or sperm preparation. I wouldn't say selection, but sperm preparation was done differently. And they managed a 46% ongoing pregnancy rate. So which is something which is, especially in these kind of cases, clearly showed that the sperm was playing a big role in what Dr. Sarpreet said, and it was reflected in some kind of a separation method, possible selection from the raw sample, which led to a better pregnancy rates. Then in this particular study, what they looked at was an outcome using in conventional IVF. So when they used microfluidic system in a conventional IVF system, and here there were four studies that were done. Number of cycles are very slow, but these were, and I think Vijay was part of this, so I will not elaborate more. But what they found was that, microfluidic system, there was an, the number of blastocysts was also better as compared to what you could see in density gradient in all the different studies done in different parts of the world. So it showed that it worked even in conventional IVF. But however, they didn't have more data and the number of cycles is much lower. Then they did it, using this system in conventional IVF and ICSI, and then looking at the fertilization rates. And one can see here again that when they looked at just blastocyst rate or a good blastocyst, even in conventional IVF, one could see that when they use the system, the rates were better. However, with ICSI also, there was a slight improvement in the good blastocyst rate. And again, the role of DNA fragmentation in ICSI percentage DNA fragmentation is quite what I would say debatable, because we say that the role is not as good. Possibly it's just a probability of chance that you select the sperm which is not fragmented. And then we have small studies coming in from India itself, presented at ACE. Again, they showed that there was a slight improvement in the blastulation rate and the euploidy rate. So all in all, it does go on to show that yes, we have a better motility, you have better lower DNA fragmentation, and the outcomes are shown to be better. And very recently, we had the OSS presenting their data at ESHRE. And what they found out was that, in patients with a higher DFI, and then they used the zymote chip, or they used the device to separate. So if the DNA fragmentation was 24%, it went down to 3%, basically going in sync with all the previous studies. So now, with so many studies coming in, I think there is enough evidence to show that DNA fragmentation is low. However, in terms of outcome, in terms of pregnancy rates, so whether this does reflect in pregnancy rates, and I think that came in the paper that was published by none other than Palermo, where he talks about can a sperm selection technique improve embryoploidy. And this is a very detailed report that has been published, looking at various aspects. And what they did was that they semen parameters in the raw, density gradient, and microfluidics. And again, you can see that the volume that comes down, so was, in the microfluidics is much, much lower. As I explained earlier, possibly it's doing some kind of selection. So the concentration comes down to be much lower than what was seen in the others. Motility, as shown in the previous studies, total sperm chromatin fragmentation, all that is much lower. So basically what he showed here was in sync with more than a dozen studies in the past, which reiterate the fact that is improved motility, lower DNA fragmentation in the sperm sorted by this. But what he found was that when he looked at the embryo developmental rate, they found that in nearly similar number of cycles, the fertilization rate was better. And after blastocysts that were biopsied, the euploidy rate was substantially higher. And naturally, if you have a higher euploidy rate, we would anticipate better pregnancy rates would be reflected. So the same thing they have presented in a graphical manner. So in the density gradient, the aneuploidy rate was much higher. However, it was significantly reduced, or if you want to look at it from another perspective, the euploidy rate was significantly higher using the separation devices. And then finally, what's more important is, yes, we have euploid embryos, we anticipate better outcomes, but the fact is, are there better outcomes? So anticipation is one thing, but they would wanted to see. And here you can see that, the implantation rate has nearly gone up 10 times, which was, it's very, very significantly higher. So also the pregnancy rate and the pregnancy loss is much lower. So it goes in with basic physiological understanding that if there is less DNA fragmentation in the sperms which are being used for ICSI, one would anticipate better. So it was reflected here. So to summarize, I would like to say, since, I understand food is going around and we're closer to lunch, but all in all, it goes to show that of the various techniques that have come in, this is something which seems is very easy to use, doesn't require much skill, honestly speaking, for an embryologist. Even a trainee person who's working in the andrology lab, this is absolutely zero skills, but it is helping us in some way to select sperms which are capable of having low DNA fragmentation, and thereby reflect in showing a lower aneuploidy rate in the embryos and naturally higher pregnancy rates. So I'm quite, and I must say in the last ISAR, it was very interesting to listen to Dr. Prabhakar, where they have shown the use of PIXI on one hand, that is actual sperm selection, sperm sorting using density gradient, and then sperm sorting using microfluidics. What he found that, yes, there was an improvement compared to conventional methods, whatever was used. But they talked about using a combination of both and a very significant improvement in the outcomes in terms of pregnancy rates. So possibly it goes on to show that the method of selection of both are possibly different. So you're selecting sperms from a raw semen sample much better with this, with low DNA fragmentation, and the hyaluronic acid binding is adding on to it, leading to better pregnancy rates. So I'm actually looking forward to listen to Dr. Ghosh's data on what it is. So if yes, so my idea was to actually bring forth the data that is there across the world in the last 3-4 years, mainly, right from the motility outcomes, which we look for, to the fragmentation rates, to the ploidy status of the embryo, and finally the outcomes. So with this, if there are any questions, yes, I'm ready to take. No? Okay.